Hey folks, I just wanted to go over SOAP notes with you. I am in the process of grading your first SOAP notes. Overall, you're doing a good job. There are some places where you may be putting some comments in one section and they belong in another, and that's part of the learning process. So I wanted to kind of go through each section with you a little bit more. Most of this you can find in that article on D2L about SOAP notes. But here goes. The S section, the subjective section, is primarily where you're going to put the main points that the client stated to you. The thoughts, the feelings, the behaviors, what's going on, what the client says about their situation. The one thing that you want to also be keenly aware of in this section from session to session is this is where you'll also be able to notice themes or patterns. Because these are the things that the client is telling us. It's their subjective experience that they're sharing with us. So that's what that section is. It should be concise, but it should also probably be one of the larger of the sections, that one along with the assessment section. The objective session, that is the concrete stuff that you as the counselor are able to see, to hear, and so forth. So basically you're going to be describing physical appearance, posture, mannerisms, those kind of things that stick out to you, nonverbal communication. That's where this goes. Obviously, we know how important that is in counseling. Well, it's important to put it in our notes so that we can remember those things. We can remember that the client cried when they talked about such and such, or we can remember that the client shut themselves off when they talked about something or when they seemed to feel something. Again, these are observations. Also, for many of us, we have notes from other professionals, psychiatrists, psychologists, or other counselors. Any observations that we have from that can also go in here if it's pertinent to that particular session. So, like a mental status exam, might you might have some findings from that would be appropriate for there. So that's the objective section. The assessment section, that is your clinical impressions. It should include, in many cases, a diagnosis and or rule out diagnoses. That's certainly the world that we live in. That's our mental health system. And most of you will work in situations where a diagnosis is it's necessary, and so I want you to have some practice in doing that. The other part of that is not just the diagnosis, it's also your conceptualization of the client. Now, the way the SOAP note flows, the assessment section, in terms of your conceptualization, it should be clear from the subjective and objective sections what you write in the assessment section. So it should flow. Assessment section, I should have evidence of what your impressions are in the O and the S, if that makes sense. So there should be a flow to how this works. And then finally, the plan. Based on your assessment, what are your plans? What do you want to do in the next session? Maybe subsequent sessions. What are some maybe homeworks that you might give or you might try to co-construct with the client? Any suggestions on interventions? I hope this is helpful, and we can talk more about this as we move along.